Hello, my name is Kripa and I'm from Leadership Initiatives. I'm going to ask you a few questions to help, come to your diagnosis. So first, I want to ask, what is your name?
Mama, wai me sunanki? Shekaran ki nawa?
Shikaran Kinawa,
Okay. Okay. Her name is Hajara Musa and she's 55 years old.
55 years old.
Yes, Shekarun Kinawa is my own language of asking her how old are you?
Okay.
Yeah, so go ahead.
Okay. Do you mind repeating her name just one more time so I can get it?
Okay, her name is Hajara Musa,
Yeah, okay. And 55 years old, right?
55 years old.
So I'm going to ask a few questions about your living and some more personal questions. Is that okay?
Wai tana so ta tambaye ki akan wasu abubuwa ba damuwa? Yes, she said you can go ahead.
Okay. First, I wanted to ask what you normally do for a living, your occupation.
Wai kina da sana'a ne mai kike yi a gida? A gida? Okay, okay. Okay, mijinki fa ya rasu. Okay, ƴaƴanki nawa? Okay, okay. She's actually a widow that does a just a petty business at home. She sells groundnut oil at home.
Okay. And at your home, do you live near any standing water of sorts?
Why, uh, would you like to start more from what actually brought her to the hospital today?
Sure, we can start with that. So what brings you into the hospital today?
Okay. Wai, kamar mene yake damun ki kuka zo asibiti yau? Okay. Okay, she's been having this fever for the past 2 days with associated headache.
Your headache. Okay. And is this fever persistent or does it come and go?
Zazzabin nan yana nan ne ko yana zuwa ya je ya dawo? Okay, the fever actually goes and comes.
Goes and comes. Okay.
Yeah.
And does she live by any standing water or so?
Yes, wai a gidanku akwai wani ruwa ne haka a tare ko rijiya ko kwata ko kuma wani ɗan kududdufi haka a gefen gidanku? Okay, they actually have stagnant water around their home. They have a gutter and they also have a well inside their home.
Okay. And
Yeah.
does she use a mosquito net at all at night?
Well, kuna amfani da gidan sauro ne idan kuna bacci? Okay. But you said she actually uses a mosquito nets, but she not all the time. Sometimes she sleeps without net.
Okay. And about this headache, does this headache come and go or is it persistent?
Yawan kan yana nan ne ko kuma yana zuwa ya je ba. Okay, 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 okay. The headache actually comes and goes.
Okay. And does she have any dizziness along with these other symptoms?
Akwai akwai kamar jiri ne ko kuma gajiya ne ko ciwon gaɓoɓi. Right. Okay, she actually does not have any dizziness, but she has some joint pain and fatigue.
And fatigue. Okay. Does she have any coughing or chills or any sort of that?
Well, akwai tari ne ko wani abu. She doesn't have any cough.
Does she have yellow eyes or yellow skin?
Wai idanki ya canja ya yi yellow ne? Okay, yes, she does have some yellow eyes and also some paleness of the body.
Paleness of the body. Okay.
Yeah.
And what does she normally eat in a day? Is she eating high protein foods or high nutrient foods?
Wai kaman abincinki a rana, kaman su me da me mafi akasari mafi yawa. Shinkafa ko tuwo ko? Sai me kuma? Eh, nama fa. Okay. Um, Actually, their food is mainly carbohydrate based. They eat mostly rice and maize gruel and also maize pap or and they hardly have any meat and sometimes they may have some vegetables but it's on occasions.
And does she have any brittle nails or feeling to eat any sand, ice, or dirt?
Wai kaman wani lokaci kina ji kaman ki ci ƙasa? Kin sa akwai masu cin ƙasa ba? Okay. Kaman farcen ki yana yawan karyewa ne da wuri ko kuma? Okay, she doesn't have any brittle veins and she does not have any appetite for non-nutritive things like ice or sand or any of those.
Okay. And does she have any other pain anywhere, like her stomach or so, or any diarrhea or constipation?
Wai akwai gudawa ne ko eh? Okay. Okay, she does have occasional vomiting, but she does not have any loose stools or constipation.
Okay. So I am gonna run a rapid diagnostic test for malaria.
Perfect. So we actually did a rapid diagnostic test for malaria that turned out positive. We also did a complete blood count, which
Mhm.
showed a hemoglobin level of 8 grams per deciliter.
Okay, yeah, I was gonna run that afterwards too. So
Yeah,
I would
okay.
say that for the malaria, I'm gonna say to take anti-malarial pills, such as um, first it would be ACT, and
Perfect.
so for the hemoglobin, that is in the mild moderate level. So
Now,
I
go
would
ahead.
um for because it's 8 to 9, I would say it is mild. So I would definitely put in some iron supplements and some possibly folic acid or B12 supplements as well. And to obviously have high nutritious foods, possibly like tofu and from soya beans, or some beans or some lentils, and to cook some leafy rich greens such as spinach and not cook them too much so that you would still preserve the folic acid.
Perfect. So, wai tana so ta ce miki kaman malaria ce take damunki, za ta baki maganin malaria, sannan kina ji? Sannan kuma za ta kina akwai ɗan anemia wato jininki a ɗan ƙasa kaɗan. Saboda haka za ta so kina cin abinci masu ɗan ƙara jini, kamar su nama, kamar kina cin vegetables kin su sannan kuma irin su awara abubuwan nan dai masu ɗan nan su za su ƙara miki jini ko? Yeah. So I've actually explained everything you said to your patient, and I don't know if you'd also like to talk to her about preventive measures of
Yeah, yeah,
malaria. Yeah.
of course. For malaria, I would definitely recommend to put the mosquito net on every day and try to remove that stagnant water if possible, of course, and as well to try to always swat the mosquitoes away. That's always our best bet, and to try to keep away from those waters as well.
Perfect. So wai tana so ta ce miki saboda ki kare kanki daga malaria nan gaba sai kina amfani da mosquito net ɗin kullum. Kin ji ko? Sannan kuma a tabbatar ana amfani da kamar maganin sauro, a fesa maganin sauro ko yawa so da saboda kar a gaba kuma ya sake samun ciwon malaria ko. Yeah. So I've explained everything you said to your patient, and she's very grateful for everything that you are doing, and she's also going to comply with all the treatment that you've recommended. So I don't know if there's any other thing you'd like to add to your patient. Else, you can wave your patient goodbye, and we have a nice day. What's an
Thank you
yeah,
both for your time. Thank you so
yeah,
much. Bye.
yeah. So you're welcome and have a nice day. Okay?
You too.